I'm Dr. Warren Hirsch, and I want to welcome you to Medical Matters Hotline. On this show, we will talk about a variety of important and interesting topics regarding your health. However, please remember that the information you hear on this program should not take the place of your personal doctor's advice. Tonight, we will be talking about alternative medicine. And joining me tonight is Dr. Feng Song. Welcome to the show, Dr. Song.
Thank you to have me on the program.
Glad to have you. Now, alternative medicine certainly is a very, very broad topic, and we're going to cover as much as we can in the next 30 minutes with you. But remember that alternative medicine encompasses so many different topics that we want to try and cover some of the more popular or more relevant type of treatments today that probably most of you are familiar with. Actually, alternative medicine and traditional Chinese medicine dates back several thousands of years, and it's based on various models, which I'd like to get into just a little bit to give you an idea of the philosophy of traditional Chinese medicine and alternative medicine as a whole. In conventional medicine, like myself as a dentist here, we pretty much focus on parts or the various anatomical structures of the human, and when people have a problem, we have specialists that deal specifically with those areas of the body. But with traditional Chinese medicine and alternative medicine philosophy, they pretty much regard the body as a whole functioning unit. So the whole idea is that this life force or life energy is basically what you're looking at. Isn't that right, Dr. Song?
Correct. And actually in Chinese medicine, regarding the 5,000 years history, it's a 5-element. Okay, everything relates with nature. And in Chinese medicine, basically 8 principles. And leading top, we have the qi and the blood. Qi is the commander of the blood. Blood is the mother of the qi. When qi and the blood is reinforced and then keeping the balance and guiding the 8 principles, and which is external, internal, excess, deficient, and also cold and hot, and interior, exterior. And then on one line, this is a yang representing, and then on the other is yin. 8 principles, and then also the 14 major meridians. Just like I-95 or I-4, you know, going from top of the head to the foot. These are major things on each exit, like I-95, exit 40. It's the exact acupoint, you know, and we explaining to the patient in that way so people can visualize specific acupoint at a specific location on a specific meridian. It has a specific function, treating certain illness and balancing the yin and the yang according to the 8 principles.
One of his points he mentioned, diabetes.
Yes, so Western medicine we call it diabetes, but in Chinese medicine we call it yin deficient. The basic problem with that is you have a 3 too much and a 1 too less. Diabetes, you drink too much, thirsty all the time. You urinate too much, and then you go to restroom too much, but you lack of one thing, energy. You have too much of a 3 and then 2 less of a 1. This is a typical symptoms with diabetes. We use different terminologies talking about the same disease.
I see. So how about taking it a step further, and what about treatment for someone with diabetes?
Well, treatment for the diabetes, actually we nourishing the yin, the kidney yin. We're kicking the kidney yin, nourishing the kidney spot through acupuncture or through herbal medicine. And then actually there are 2 different types of the problem causing kidney yin and then diabetes versus we say yin deficient. And we use herbal medicine and then sometimes scalp acupuncture to reinforce the kidney function, to help the spleen, because this is related with digestive tract. This is an enzyme, this is the lot of things, and you have to look into balancing the inside the internal viscera.
I find this very interesting. So therefore, somebody with diabetes who normally is used to taking, say, injections of insulin.
Correct.
That's right. And then we do actually putting the yin, treating the yin deficiency and then spleen, promote the water metabolism, helping that to create more and more towards the normal level. And usually when they come to our office, usually they all have the test done.
Yes.
So it's very simple. And then we utilize the results of a test and then use the same modality in Chinese medicine, like acupuncture, like herbal medicine, like injectables. We can do the scalp acupuncture. We can do a lot of modalities to treat
And
this
even
kind of
nutritional
patient.
counseling.
Yeah. Chinese doctors value very much about the pulse. There are 28 abnormal pulses. When we check the pulse, we are not checking the pulse rate. Everybody can do it. 3-year-old boy can count the minute and then do it. We do check the quality of the pulse. Like somebody is running high fever, the pulse definitely can tell. You're running hypertension, or even subtly, female, like 4 months, 3 months pregnant, did not even tell you. From the pulse, you can tell. It's very, very powerful. And then also the tongue. We encourage patients not to scrape their
not to scrape your tongue when
before
you come to the office.
And then we value the coating, the shape, the size, the color, the differentiate on the tongue coating to tell the internal problem. People are all accustomed to the conventional medicine, right?
Yes.
And then for the emergency, for the catastrophe, trauma, something emergency, operation, blood test, everything, stool test are very, very important. But in our medicine, we focus on more about
How they live.
Yeah, how we live. And
Yeah.
actually, we're fixing the root of the problem. Like we see floor all wet, leaking somewhere. Instead of mopping it dry, we find Chinese medicine is really finding the leaking spot. We fix it in a leaking spot and come back to dry the floor. So the root of the problem is taken care of, no more problem. You know, not just like touching, give you the medicine, ease it off, like a permanent relative, depend on the medicine. When we fix the leaking spot, and then the root of the problem is resolved, no more problem.
No more problems.
And then you don't have to be on medication all your life and then as your relative.
Our
right?
goal as physicians is to not
quite different.
see our patients. Again, we want to heal our patients. Chinese medicine looks like
That's right.
Dr. Song is saying for the root of the problem. We don't want you to be like a unwanted relative. We don't want to see you for the rest of your life. We want to come in, we want to give you a prognosis on how long it's going to take us to treat your problem. And then we are going to work towards that goal with your help. For instance, you might have to change your diet. You might have to change where you live. Maybe you might have to change some of your personal habits, because those are the things that are basically feeding whatever kind of problem it is that you're bringing to us.
That's interesting.
And then there is another interesting thing, like your professional dentists. Acupuncture actually does powerful, we call it qigong needling, can stop the pain for the dental work. In other words, we put a certain points on related meridian, and instead of anesthesia, we manipulate, very fast manipulation. That's a qi gong manipulation to stop the pain and then numb the certain nerve. So you can greatly reduce the amount of anesthesia you do when you do the dental work. So the patient doesn't have to be swollen and then recover from all the dental local injection. That's another, has been done so many years in China. And then some of the dentists in this country and in Florida has that application in doing that in our office.
That's very interesting, especially since as a conventional dentist here in the United States, we're used to just using anesthesia, as most everybody is. But it's interesting to know that acupuncture definitely would be a different alternative that we're not familiar with. A lot of us in this country, of course, trained in dental schools in the United States.
We talked about the excess and the deficient before, 8 principles, one of them. And the liver can never be deficient, can always tend to be excess, too much. So you need to balance the liver qi stagnation. The liver qi stagnation can cause you very stressed and depression and suicidal even, all right? And then a lot of people say, oh, this is caused by liver qi stagnation. And then that is the one when you get upset, somebody, and then suddenly, or you're too happy or too upset, and then suddenly you have to run to the restroom. That is what we say, liver qi stagnation, invading stomach, digestive tract, and then invading the large intestine.
And so therefore, all of you know that you can take advantage of this type of healing situation by seeing alternative medicine. and know that it's something else that's around that we're not real familiar with here, but definitely is something that's alternative.